Okay, now we're going to do Chapter 30, Number 9. Suppose that a government agency guarantees to pay all of an individual's future healthcare expenses after the end of this year, so that the effective price of healthcare for an individual will be zero from that date onward. In what ways might this well intentioned policy induce the individual to consume excessive, quote unquote, excessive healthcare services in future years? So the reason I threw this in here is because it's kind of a nice way to look back at a number of things we have discussed, really, I think, starting with the first class, and apply them to something that I know many of us are very interested in, healthcare. So I'll start at the beginning then, the one aspect that we covered. One thing is, at the very beginning of the semester, we went through 10 principles of economics, and one of them was people respond to incentives. And I mentioned an example. I gave an example of an incentive structure that you might not have ever thought about a guy I went to high school with whose parents always took care of him and were going to get him a car whenever he needed a car when he was 16. And we explored how that went. And I introduced, I think it was on the board even, but it wasn't part of the chapter. I introduced the concept of moral hazard. Moral hazard is something to consider anytime you are in your own mind or for empirical purposes. Anytime you're assessing any sort of an insurance program, moral hazard really should be something to think about. Moral hazard is this idea that when there's a safety net put under us, we tend to need the safety net more. So in health insurance, the argument would be, the reason it would be excessive use in the future would be if people know. Look, let me back up. Right now, if I do something that's not good for my health, I bear a couple of consequences, or I risk a couple of consequences. I risk the health outcome, but I also risk the financial outcome because I have to pay to find out what's wrong when things aren't working right, and I have to pay those medical bills if it does go wrong. When somebody else is going to pay for my health care, I still face the health consequences, but I don't face the financial consequences anymore. So my expected cost of not taking care of myself is reduced. And if people respond to incentives, that would mean that my consumption of that good or service, healthcare, would likely go up. Personally, over my years, many, many years of college, there were times when I had a job and had health insurance, and there were times that I didn't. And the times that I didn't, I really didn't surf that much. When I had health insurance, I surfed, actually, a fair amount, because that's something that I know I could easily get hurt doing, and it really affected my behavior whether or not I had health insurance. So that's the moral hazard aspect of it. That's one thing to consider. Another is just shifting. Recall when we looked at the determinants of demand. We're just discussing the demand for healthcare, all else held constant. Expectations was a determinant. Well, if this provision is going to start at the end of the year, and I have an ache or a pain, or I think something might be wrong with me, why would I go to the doctor now and pay out of pocket if I could put it off until the end of the year? And if a lot of people are doing that, that would mean after the date, there would be a shifting from services that might have been rendered before the date till after the date. So there would be more services now that the healthcare provision is in effect. So it would be shifting demand from present to future due to expectations. So that's the second reason. That's just kind of mechanical. And one would hope that wouldn't be, I've never cared for the term unintended consequences, but one would hope that would certainly be thought of, that people would do that. And then there's a third reason. This is a little bit more controversial around healthcare, but it is what it is. When healthcare is paid for out of pocket, or even in part out of pocket, it discourages the use of it, which is why we generally like the idea of universal health care or government provided health care, that sort of thing. Um, and so when you have an ache or a pain and somebody else is going to pay the bill to go to the doctor, well, and I go through this, I have a pain in my chest or something like that, or actually I currently have one up in my shoulder, and I'm like, yeah, maybe I should look into that. Well, if somebody else is paying for it, I'm certainly more likely to look into that. In other words, I don't have much incentive or much downward pressure to contain costs when somebody else is entirely paying the bill. The more of the bill I'm paying, the more I say, let me really ask myself if I think this is a problem. And sometimes I go to the doctor, sometimes I don't. Now, I mentioned that we've touched upon things along the way. Here's a connection you probably didn't make, but I can help you get there. When we looked at costs for a firm, we compared marginal costs to marginal revenue. And a firm's ideal output level, where we expect them to be, is where marginal cost equals marginal revenue. Well, think of healthcare in terms of marginal cost and marginal benefit. If I go to the doctor with, let's say, a copay, let's say a $100 copay or $60 copay, okay? My marginal cost of going to the doctor includes anything I give up in terms of time to go, but it also includes $60. And my marginal benefit is the probability weighting of what I think that might be wrong with me being remedied times its probability, right? So that's my marginal benefit, is getting fixed whatever's wrong with me, and how the probability that I give it that it actually is wrong. But my marginal cost is everything I give up, including a copay. If you reduce that marginal cost, now marginal benefit over marginal cost is much greater. And if you think about that in terms of our firms, which is something you probably weren't relating to healthcare on the individual decision making at all. But if you think that in terms of our firms, you're talking about where marginal benefit is well in excess of marginal cost because somebody else is paying the copay part or paying the doctor bill. And so that would increase our use of the service, because now it's more beneficial to go and less costly to go until I've gone a greater number of times, and then what I'm giving up in my opportunity costs might become high enough to make me stop wanting to go. So those are 3 reasons that we would expect a sudden rise in demand for healthcare: moral hazard, time shifting, and just the transfer of the cost from the user of the healthcare to the government. There's also a case that doctors get paid by the number of visits, and so when it's not costing the consumers, the doctor's certainly happy to come, schedule a follow-up visit. So that's the answer to number 9.